My study is a comparison of conventional disease-modifying drugs with and without intra-articular platelet-rich plasma injection in the alteration of disease progression of early cases of rheumatoid arthritis involving wrist joint. Rheumatoid arthritis, as we all know, is a symmetric inflammatory polyarthritis, mainly affecting the wrist and hand joints. Thereby, it impacts the activities of daily living. And early rheumatoid arthritis, it's defined as a duration of up to 6 months according to ACR 2015. And ultrasonography in RA can be used for diagnosis by seeing the synovitis, and it can be used as an assessment to monitor the by grading the synovitis, we can monitor the follow-up. The current treatment guideline is that disease-modifying anti-rheumatic drugs as a standard treatment, and there are newer modalities coming up like injection of platelet-rich plasma in the joint and the use of biologics. So PRP is an autologous blood product where we centrifuge blood to achieve a therapeutic PRP concentration that is 3 to 8 times the normal. And because of all the growth factors present in the PRP, it has various effects, one of which is anti-inflammatory effect. The aim of my study is to compare conventional disease-modifying drugs with and without intra-articular platelet-rich plasma injection in the alteration of disease progression of early rheumatoid arthritis. Why I have conducted this study is because I have taken up wrist joint, which is one of the most commonly affected small joints in RA, and which is important for most of the activities of daily living, and once involved, it leads to joint damage, which is irreversible. And conventional disease-modifying drugs do not promise a long-term remission. Here, I have attempted to study the effectiveness of intra-articular PRP in early RA involving the wrist joint, and ultrasonography was used to assess and monitor synovitis, and injection was given under ultrasound guidance for accuracy. My study is a randomized controlled trial done for 2 years in patients attending OPD with pain and swelling around the wrist joint, and those who fulfill 2015 ACR criteria for adult early RA with the ultrasound finding of synovitis without bone erosion was included in the study. Sample size was calculated to be 50 using the formula and taking into consideration the study done by Mortada et al. And these 50 patients were grouped into group A, that is intervention group, and B, that is control group, by using block of 4 randomization technique. The study was approved by Research Ethics Board RIMS, informed consent was taken, and it was registered in Clinical Trial Registry of India. The dependent variables were visual analog scale, disease activity score, power Doppler ultrasound grading, and Cochin hand functional scale, and follow-up was done at the end of 8 weeks and 20 weeks. For those patients who are in intervention group, they have received triple combination DMAR therapy orally, along with ultrasound-guided intra-articular injection of PRP in the wrist joint. For assessment, I have used VAS, DAS28-ESR, power Doppler grading, and Cochin hand function scale, which was done at the end of 8 and 20 weeks. Data was entered and analyzed using SPSS, using chi-square test, independent t-test, and repeated measures ANOVA. And a p-value of less than 0.05 was taken as statistically significant. Coming to the result and observation. Table 1 showing the comparison of baseline variables between intervention and control group. Here we can see that the p-value were all more than 0.05. That means it is not significant, hence the two groups are comparable, and we proceeded with the study. Table 2 showing mean changes of outcome measure from the baseline. I'm comparing between the intervention and control group. Here we can see that at first follow-up, that is at the end of 8 weeks, the improvement was more in those who received intra-articular PRP, and the p-value was found to be significant. At the end of 20 weeks, the findings were comparable, however, p-value was not significant. These are the line graphs showing the trend of outcome measures with time. Here we can see that in intervention group, there is a steep graph. That means patient who received intra-articular PRP had early and persistent improvement, while in control group, it was gradual. So present study, it showed improvement in hand function with corresponding decrease in pain and disease activity in all the follow-ups, and improvement was better and it was early in those who received intra-articular PRP as an add-on over triple combination DMARD therapy than who did not. Several other studies have also found that there is anti-inflammatory effect of PRP by inhibiting the production of inflammatory factors, and the growth factors and cytokines present in PRP accelerate healing and improves function in patients of RA. There are other studies showing good safety profile of PRP in RA and with decrease in disease activity. And Staff et al., a study that compared the effect of intra-articular PRP and steroid, showed that there is comparable improvement at the end of 3 months in improving pain and inflammation of the joints in RA. So the limitations are, we focus only on wrist joint, and we had a very short follow-up period. And I would like to recommend further studies with larger sample size and longer follow-up with inclusion of other small joints. To conclude, addition of intra-articular PRP in wrist joint along with disease-modifying anti-rheumatic drugs has early and better improvement in pain, and it delays disease progression. This can be attributed to the fact that intra-articular PRP injection, it reduces pain, it decreases inflammation, and improves function. Moreover, it is a very safe treatment modality. These are my references. Thank you.